For my current issue and professional nursing project, I have chosen to do mental health in the community. Pratt, Kansas is a small city located in Pratt County, which is tucked away in south central Kansas. For those unfamiliar with the area, it is easiest to describe the location by telling travelers that Pratt is located 80 miles straight west of Wichita. The city of Pratt is sprinkled with upkept neighborhoods, schools, and parks, all of which are utilized by the residents who call this city home. The setting in which the residents live and function can be painted with the colors of the city's history. The city was founded in 1884 on the Kiowa Indians' hunting territory. Pratt has since had many groups and politicians who have worked together to create the city we are familiar with today. This includes the various politicians, school boards, hospital foundation members, and chamber members who are committed to bettering our community. The median age of residents who reside here is approximately 35.8, with the vast majority of residents being English-speaking Caucasians. The state of Kansas has a mostly white population too, with a reported statistic of 86.5 white residents. African Americans make up just 1.3% of the population, while Hispanics make up 7%. The dominating sex in Pratt is female, which is just barely above the male population here at 52%. As far as economics go, $42,000 is the median household income, with 57% of persons reporting an income under $50,000. The percentage of people living in poverty here is 16.3%, which is higher than the rate of poverty in the rest of Kansas. Overview of the community. Healthcare facilities. The city of Pratt hosts a 69-bed acute care hospital, Pratt Regional Medical Center. PRMC also offers rehabilitation and long-term care housing. Home health services are also provided by this entity. In addition, there are also several local clinics, including Pratt Internal Medicine Group, Surgery Center, Bone and Joint, and Pratt Family Practice. Pratt also offers the Hope Center, which provides an array of services to those enduring financial hardships. The Hope Center is located on Main Street, and within that building is the Agape Clinic. The Agape Clinic offers monthly walk-in clinics with providers from Pratt Family Practice. We also have a health department here, conveniently located on Main Street. In addition to these facilities, there is Arrowhead West, which serves children and adults with developmental disabilities. Pratt has an average of 2.4 persons per household, with 47% of people reporting to be married. The average number of persons per household in the state is comparable at 2.53. There are mostly single-unit homes here with a reported 3,157 living units. The majority of residents here hold a high school diploma or higher, with almost 90% of people reporting that they had graduated high school. Just over 20% of Pratt residents reported having a bachelor's degree or higher, which is below the state's data point. The majority of residents are in the labor force, with 61% of the local population being employed. This percentage falls just below the Kansas employment rate of 66% of persons employed. Listed here, I have identified a couple local health behaviors. Each of these behaviors, as we know, ties into a person's mental health. These behaviors include adult smoking, adult obesity, excess to exercise opportunities, and excessive drinking behaviors. In regards to the issue and why is this issue thought to be a current problem, I felt that this quote was appropriate to introduce this. The stigma associated with having a mental health condition or seeking treatment is often cited as a specific barrier to mental health care. The issue: mental health lacks prioritization. Why should mental health awareness be a priority? It encompasses our psychological, emotional, and social health. Mental health affects us at all stages throughout our lifespan, from early childhood to late adulthood. Mental illnesses are very common in the United States. Nearly 1 in 5 U.S. adults lives with a mental illness. Only about half of people with a mental illness even will seek and receive treatment. Some of the common health behaviors previously identified within this PowerPoint could be related to the mental health of these individuals, such as the drinking, smoking, and the illicit drug use. There is a lack of mental health services offered to this community, and there's a high rate of young adults in jail with drug-related charges. Social impact, views on the issue. This quote came from a local nurse who works here at the hospital. She said, "We see such a high rate of patients with the mental health issues here, especially in the healthcare setting where I work. I think people don't realize that the number of people suffering from mental health problems is significant." Social impact, services and programs. The Pratt County Health Department was established in 1961 and believes that everyone is entitled to receive adequate preventative health care at an affordable price. Our service area is Pratt County plus a 50-mile radius within our county. We are well known for our small, hometown-friendly atmosphere where everyone is welcome. Functions as listed below: immunizations, nutritional information and/or assistance, information and education caring for infants and children, well-person health assessments, early intervention health screenings, family plan and well woman information and services, and disease investigation. Fees may vary depending on the service. Most insurance companies are accepted, and no one is denied services due to the inability to pay for them. Social impact, services and programs. Arrowhead West. AWI provides support services to children and adults with developmental disabilities. Today, AWI has a service area of 14 counties in Kansas: Barber, Clark, Comanche, Edwards, Ford, Gray, Harper, Hodgman, Kingman, Kiowa, Meade, Ness, Pratt, and Sedgwick. Functions include day services, residential services, community integrated employment, targeted case management, transportation, infant-toddler services, and volunteering. Social impact, services and programs. This is just a continuation of the Arrowhead West general adults admission criteria. It just lists everything that a person must have in order to qualify. And then at the bottom, it tells you the following steps specifically for seeking services at Arrowhead West. Analyzing the issue. Strengths of the community related to this issue include population size of the community support through free programs, and multiple schools allow for early screenings. Weaknesses include funding, stigma related to mental health problems, and access to alcohol, illicit drugs, and etc. Methodology to address these would be the observation of statistical data in relation to this issue. For example, data shows us the community size. Data tells us precisely how many programs the community holds in relation to assisting with mental health. Data tells us the number of schools within this location. Statistics also tell how many students there are in these school systems. Funding most generally is provided by community members as well as state funding. Community members and church groups donate supplies, volunteer their time, as well as many other things that work together toward improving the issue. One intervention in which I think could be extremely beneficial would be the implementation of routine mental health screenings in schools. This includes the middle schools, junior high, and high schools. 50% of chronic mental health issues start by age 14, and 75% of mental health conditions begin by 24 years old. The intended outcome of this intervention would be to increase the early identification of mental health conditions by performing routine screenings in the school system. When researching, I found almost an endless amount of supporting evidence to implement this intervention, some of which include 50% of chronic mental health issues start by age 14, and 75% of mental health conditions begin by 24 years old, as I had mentioned already. The delay between when signs and symptoms are first displayed and treatment is 8 to 10 years on average. Mental health screenings assist in early identification of potential conditions, allowing earlier treatment to close the gap in delayed treatment. Research tells us that treating these signs and symptoms earlier is leading to an improved outcome later. School staff can recognize warning signs and connect students with the necessary support that they need. The Medicaid early and periodic screening, diagnosis, and treatment law requires states to provide Medicaid-eligible children regular mental health screenings, although they say that many states do not follow this law. Last, I just wanted to include some of the national crisis hotlines, important numbers to know if someone does need help. There are multiple resources available to help those in need.